Hi everyone, I'm Dr. Mary Ambach. Welcome to our YouTube channel. If you're new here, I specialize in orthopedic regenerative medicine and natural treatments that support your active lifestyle with innovative, long-lasting, non-surgical care.
Okay, so I will be talking about orthobiologics for hip pain. We'll continue the discussion, and we were tasked to talk about specifically about these four conditions: vascular necrosis, labral pathology, FAI, and hamstring tears. So for a vascular necrosis, majority of the research that's done in this space is by Dr. Philippe Hernigau, who is a orthopedic surgeon from France, and he actually presented his 40-year data on 10,000 patients on the use of bone marrow concentrate for orthopedic conditions in the recent IOF conference. Majority of these studies were on the use of bone marrow concentrate for vascular necrosis for hip, shoulder, and knee. His latest data was this on hip osteonecrosis was this RCT of 125 patients with bilateral hip osteonecrosis. The less osteonecrotic hip received core decompression, and the more osteonecrotic hip received MSC injection from bone marrow concentrate. And the results showed that the bone marrow group had more decrease in their pain and joint symptoms. They had less number of femoral head collapse and less need for total hip replacement. They also showed that the bone marrow group had more improved MRI findings in terms of the area of the necrosis, had better improvements in histology in terms of new bone formation and neovascularization. This is an RCT on intra-articular PRP versus shockwave therapy for early vascular necrosis. And this is a weekly PRP injection versus a weekly shockwave therapy times 4. And the results showed that both the PRP and shockwave therapy had significant improvements in the pain and function, the VAS and the WOMAC score, but the PRP was superior than shockwave in these functional outcome measures. This is an RCT on PRP versus, on PRP and decompression versus decompression alone. And the results showed that the addition of PRP to the core decompression not only provided significant pain relief and function, but also showed better survivorship from collapse and surgery in early stage AVN. The survivorship from femoral head collapse is 84% from the combination of core decompression and PRP versus 68% for core decompression alone. And the survivorship from total hip arthroplasty was 92% for the combination treatment versus 78% for the core decompression alone. With regards to labral tear, it's very rare to find isolated labral tear pathology, and thus it was hard to find data on this and also to find focus studies on this specific pathology. But this was a prospective pilot study by Dr. De Luigi, wherein he performed ultrasound-guided PRP injection directly into the labral tear, and he found a statistically significant improvement in their hip Harris score at 8 weeks. This is my hip, and this is an intra-articular PRP injection for my small symptomatic labral tear. The first ultrasound image, you can see the soft tissue lidocaine injection before the joint injection. The middle ultrasound image is showing the intra-articular PRP flow right by the femoral head. And the third ultrasound image is showing the intra-articular PRP flow deep into the femoroacetabular joint. So this is an N of 1 with Dr. De Luigi's N of 8. So we're N of 9, and we're making great strides in orthobiologics for isolated labral tear. With regards to FAI, same thing. There's no published research on the efficacy of orthobiologics strictly for FAI in the non-operative setting. Majority of the orthobiologic studies are in the setting of hip osteoarthritis with or without other articular pathologies. This is an RCT on PRP augmentation of arthroscopic procedure versus arthroscopy alone with a 2-year follow-up. showing that PRP resulted in better post-operative pain within the first 2 days and less joint effusions within the first 6 months. The data past 6 months up to their follow-up of 2 years did not show any statistically significant improvement with the pain and function. So we're still unclear on the long-term data for PRP augmentation. This is a prospective cohort on arthroscopy versus arthroscopy plus bone marrow concentrate with a 2-year follow-up, showing that the BMC cohort resulted in better pain function at 24 months and a significant improvement in their function in the modified hip Harris score and the hip outcome tool at 24 months. With regards to hamstring injury, there's actually several published RCTs on this particular pathology. This is the RCT by Hamid comparing PRP versus PRP plus rehab for acute grade 2 hamstring injury. And their study showed that the PRP plus rehab did significantly better than rehab alone with better pain relief and also an earlier return to play of about 2 weeks, which is actually pretty significant. This next one is a tendinopathy study, intertendinous PRP versus whole blood injection. And the results showed that the PRP had improvement in all the outcome measures at 6 months, but was only statistically significant in one outcome measure, which is the hip outcome tool. The following 2 RCTs showed that the PRP did not show any significant difference versus PRP plus rehab in contrast to the study that we just discussed, and also in contrast to controlled saline injection with regards to acute hamstring injury. So take-home points for vascular necrosis, PRP and bone marrow concentrate may have potential benefits for early-stage AVN. With regards to labral tears and FAI, there's limited evidence in the use of orthobiologics for non-surgical treatment of isolated labral tears and FAI. But PRP and BMAC as adjuncts to arthroscopy may potentially significantly improve pain and function compared to surgery alone. And for hamstring injuries, the studies have variable outcomes for the use of PRP in the treatment of acute hamstring injuries. Thank you very much.